Okay, ladies and gentlemen, good afternoon. I am Councillor Graham Bridgeman. I am the portfolio holder, West Berkshire, for the Health and Wellbeing portfolio, and I am chairman of this board. Now, tonight, I know that some people may be a little late, so I'm looking around the room to see who's here, and I'm joined tonight by Councillor Lynn Doherty, Leader of Council, Councillor Macro, and I think we're waiting for other councillors to join us. We've also got Matt Pearce, who's Service Director for Health and Wellbeing. We've got Andy Sharp, who's the Executive Director for the People Directorate. Sean Murphy from our Public Protection Partnership. Joe Reeves from the Berkshire West CCG, and Martin Dunscan from our Communications team. The clerk to the meeting and the Zoom host is Gordon Oliver, and I'm going to start by asking Gordon just to run through our standard reminders about Zoom meetings.
Thank you. In addition to the points shown on screen, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone has raised a Zoom hand has spoken, anyone who has telephoned in will be invited to speak in order. Any voting will be done by a show of physical hands, and if we need to adjourn the meeting for any reason, then you'll be advised of the revised time and date of the meeting. If it's a short adjournment, you'll be able to rejoin this Zoom meeting, otherwise a fresh appointment will be sent out. Do members have any questions?
Gordon, I'd be astonished if they do. We've heard this quite a few times now. Gordon, do we have apologies for absence?
Yeah. We have had apologies from Councillor Jo Stewart and from Councillor Martha Vickers and Councillor Alan Macro substituting for her. And we've also had apologies from Nick Carter.
Okay, members, those of us who were in the meeting, the minutes that you've had of the meeting of the 24th of May, are they correct? Does anyone have any corrections they wish to propose? No. So I am very happy to propose those from the chair. Councillor Doherty, thank you, to second them. And those who are in the meeting, do you have approval for the minutes? I certainly do. Physical show of hands. Looks like it's just the two of us, Lynn. Righty-ho, well, there you go. Small but perfectly formed, I'm sure. Okay, so Gordon, declarations of interest. We had any declarations of interest, and then I'll ask if anyone wishes to make any.
Nothing in advance of the meeting, Chairman. Thank
you. And anyone wish to make any declarations? No, fine, thank you. Now, I was going to take the COVID situational report first, because obviously, as anyone watching will know, there have been developments in other parts of Berkshire, and I thought we should touch base on that, because that would then lead in, I think, to the vaccination programme, which was going to be first on the preceded on the agenda. Now, I was hoping that Meredin Peachy, who's the guru on public health for the Berkshire West, she's the Director of Public Health, would be in the room to talk to us. Matt, are you happy to go with this item, or do you want to wait to see if Meredin could join us? Oh, look at that. Speaking of the devil, she arrives as we... Well, let's let Meredin get into the meeting.
Did you want me to do an overview to begin with, and then Meredin can compliment?
Meredin, your ears were burning.
I must have been.
As I said to you this morning, we're going to swap these two items over, but I'll let Matt kick off. So this is the COVID-19 situation report. Let Matt kick off and then let you come in, and then we'll go on to vaccinations. Thank you.
Okay, thank you, Chairman. So what I'll do is I'll go through the situation report for the first few standard slides, which you'll all be quite familiar with. And then what I was going to do is just show a few slides around variants of concern, what the latest variant position is, and then hopefully Meredin can provide a bit of context in terms of what's going on in Reading and Wokingham. So in terms of the overview, again, one graph you'll be familiar with, table, sorry, as obviously West Berkshire's in the middle. As you can see, there's quite a few reds now, considering what there were a few weeks ago. So as you can see, Reading, Bracknell Forest, Slough and Wokingham have all seen an increase in their rates, including their positivity rates, which is this line here, all over around 2% now, and their cases per 100,000, all over around 70 per 100,000 or more. Obviously, importantly for West Berkshire and our residents, our rate remains relatively low, the second lowest in in the Berkshire area, 21.5. I believe that's just gone up to 22 from the latest data released tonight. Importantly, our case rate per 100,000 per 60 or plus is 2.5. It's gone up slightly, but relatively low. But as you can see in Reading and Slough, they have slightly higher case rates, still lower than what we've seen in the other two waves. That's positive. I think with the variants, I think that the case rate in itself is quite a good indication, actually, that there's likely to be a high prevalence of the Delta variant, otherwise known as the Indian variant, within those specific areas, and we'll come on to that in a little bit more detail. So again, I mentioned it's 21.5, which is closely to the regional and national average. What I thought would be quite helpful is just go on to the recent 7-day case rates by specimen date. And I guess I just wanted to show this, a bit complicated this one, but I'll talk you through it, just to show the variability in our rates, which is down to local outbreaks, which I've spoken about before. So this is just from the middle of March, really. You can just see the ups and downs of our 7-day case rate, and this does tend to map with some big outbreaks that we see in the community. And the bottom graph here just shows a percentage change in 7-day case rates. You can just see how, again, our case rate has tended to fluctuate. As you can see in Reading and Woking, we're probably seeing a different pattern, which is a bit more of an upward trajectory rather than this up and down rates. And again, that's down to which we largely know now is the Delta variant, which is prevalent in that particular areas. So again, this is just the epi curve for each of the Berkshire local authorities. Again, you can't really see much, but if you look at Reading, you can see the blue line, which is reflective of that local authority, just now starting to go above the southeastern national average, and the same can be for Slough and then also Woking. You can just see that blue line just going above those two colours there. So clearly we're concerned about those specific areas, and I'm sure Mervyn will go into more detail about that later. In terms of the death rate, fortunately, there's been no new deaths since the week ending 7th of May. So that continues to be good news, and again, largely reflects the impact of the vaccine. There has been some new data come out, actually, which I was going to present tonight, but I didn't have time to put together about long COVID and some estimations on numbers and self-reported symptoms. So I'll probably bring that to the next LOEB if that's of helpful to the panel. In terms of hospital activity, so again, this is quite dated, but the most recent data I have is that there's 5 beds occupied with confirmed 19 patients and 2 diagnosed in the past 24 hours. So a slight uptick, but yeah, it's quite difficult to read into that at this point in time. And again, I'll cover the latest evidence we have in terms of hospital admissions on the new Delta variant in a few slides later on. But clearly we're watching that closely, as are our NHS colleagues. In terms of the age-specific 7-day rolling case, so has been the picture for the last few weeks now. We're continuing to see the higher case rates amongst the younger age groups, as expected, largely because they socially mix more, but also because they haven't been vaccinated. So you can see the darker colours just reflecting where those case rates have been slightly higher. You'll remember back in the middle of May, we had quite a number of outbreaks within primary schools, which are the darker shades down here. And you can just see we've had a slight increase in cases between the ages of 19 and 24 and 17 and 18. In terms of the weekly rates for our wards, because the numbers have been quite low, we've actually started to put this into 4 weekly rates just to see if we can identify any patterns. I'm not going to go into this massive amounts of detail. There are a few ward outliers there. Again, that's largely down to some outbreaks within those specific areas. But apart from those, we're not really seeing any hotspots, if you like, for wards across West Berkshire. But again, we watch that closely daily. So I just want to go a little bit into the variants, just to cover, because I think it's really helpful to understand what do we mean by a variant, but also the local context of variants. And the first thing to note really is that we know that viruses naturally mutate all the time. So every time the virus jumps between individuals to individuals, there is an opportunity for that virus to mutate. And this is the same in any communicable disease. So it's nothing new in terms of public health. But what we do know is that changes can build up in the genetic code of the virus, and these new viral variants can be passed from person to person, and sometimes they can change. And largely, the change doesn't actually mean any difference to the severity or transmissibility of virus, but every so often the virus does mutate in a way that benefits that particular virus. So it could spread more quickly, or it could cause more severe illness. And that's where the term variants of concern come from. It's normally where there is evidence that actually it can spread more quickly or cause severe illness. You may have also heard of the term variants of interest, and these again is very similar, but that there's suggestions or indications that actually that a particular variant may affect transmission, diagnostics, or immune escape, but they tend to only move into a variant of concern once there's that more evidence to suggest that actually the impact is quite significant, and we need to watch that closely. So I'm not going to go through all the variants of concern or interest. There are quite a few of them, but to date there's 5 variants of concern and 9 variants of interest that we're aware of. And some of you might have heard me use the interchangeably terminology already. So the World Health Organization have obviously classified the new COVID variants under names alpha, beta, gamma, and delta, mainly down to where those particular variants were first identified, not necessarily where they come from. So delta really is the variant of interest at the moment, which is causing some concern. The other one that's always caused some concern is South Africa, but the prevalence of that particular variant in terms of the beta variant is quite low. As many of you be aware, the Kent variant has been the most dominant variant across the UK for some time now, and has made up a large proportion of our cases. But as you probably would have heard in the news, the Delta variant is now showing more transmissibility and would likely become the more dominant variant as time goes by. So there's still lots we don't know about the Delta variant, and I think I need to be clear from the offset, and you'll hear lots of figures being bandied around by various different scholars, researchers, and the government, but there's still lots we don't know. So some of these figures are really indicative. At the moment, the Delta variant is estimated to be at least 40% more transmissible. And Sage had previously suggested that a variant that's 40 to 50% more transmissible could lead to a much larger peak than previous waves of the virus seen at the start of this year and last spring, which might be a surprise to many on this panel, but I'll go into that detail in a minute. But clearly there are concerns about this variant, and one of the best ways out of that is the vaccine programme. There is some data, which again I'll go into in a minute, is about an increased risk of hospitalisation with the Delta compared to the Alpha. Although, again, we're still waiting for more data to really confirm whether that is the case. And in terms of modelling what that impact might be is incredibly difficult. And hopefully the SAGE minutes will come out over the next few days and might give a bit more of a clear understanding about what that might be. In terms of nationally, the most recent data shows that of the sequence cases, 73% are Delta. And the other thing they're quite concerned about is the secondary attack rates, which is the proportion of COVID cases that go on to actually infect other people, such as household contacts, and that's showing quite high secondary attack rates with that particular variant. This graph was in the latest SAGE minutes. And again, this just shows you the growth rates using an S-gene data. And S-gene is basically, we know that the Indian variant or the Delta variant contains the S gene, whilst the Kent variant doesn't. So it gives us an early indication about what that particular variant is or an individual might have. And then the green line here just really shows you the steepness of the growth in those particular cases that have the Delta variant. So it can just show you the speed and the proportion of those cases and how quickly that's growing across England. This data just came out of a PHE technical briefing. I won't go into too much detail, but it just gives you a sense in terms of some of the early findings we're having in terms of what that Delta variant looks like and its impact. So this was in England between 1st of February and 31st of May. The overall total of Delta cases is around 9,500, and within 20 days, there's 7,744. So those individuals that had the Delta variant, 5,000 were unvaccinated. 303 individuals had a dose 1, but within 3 weeks, we know their immunity might not have been built up. And just over 1,300 had post 21 days of their first dose, and 267 received 2 doses. And you can start to see on this final column, when we look down at A&E visits, again, I won't go into too much information, you can actually see those that received the 2 doses, the numbers are relatively small. before. So it really does show that actually the level of protection you get from 2 doses with regards to the Delta variant is really, really important. So even those that have had a single dose, we know that the protection isn't quite as good as having 2 doses. So that's one of the reasons we really want to encourage as many people to have those 2 doses going forward. And it's also worth noting that no vaccine is 100% protective, and we need to be aware of that. So any growth in cases still might lead to a significant number of individuals that had 2 doses being admitted or suffering from poor health. So why do rising infections matter? So as I said, even though most vulnerable people are protected, a more transmissible virus means that more people will likely need hospital treatment. And about 98% of COVID deaths occur in age over 50, and 700,000 people nationally over 50 have not been vaccinated, and these people could put pressure on the NHS system. So you have to look at the whole population when we're considering what public health measures are needed. And then nationally, less than half of adults under 40 have received a first dose, and less than 20% are fully vaccinated. That's national data, we're a little bit higher in West Berkshire. But we know that adults under 40 account for 39% of COVID cases, even though they only make up 29% of the population. Vaccines are not 100% effective at stopping hospitalisation, even after 2 doses, as I just said. And PHE have suggested that the risk of hospitalisation could be up to 2.6 times higher than the Kent variant or the Alpha variant. And there's some evidence that the Indian variant has mutated enough to escape the protection offered by existing vaccines. But as I said, at the moment, data suggests that 2 doses gives you strong protection. So in terms of the data that we have in West Berkshire and our local authorities, so this is those local authorities that surround West Berkshire. This is publicly available data. I think we have to be clear that these are probably largely underestimates. We don't necessarily always sequence all cases, around 60% at the moment, but it just gives you a sense of where things are. So we've got Swindon at the top. They've had 39 variants noted to date, 180 between May and 2nd of June. And 22% of all confirmed cases. We look at Reading, that's 17%, Woking 11%, and West Berkshire's down here at 4% and 7%. I think the latest we have is around 13 in West Berkshire, but some of that is provisional and that needs to be confirmed. And then if you look at the top 10 lower tier local authorities, that gives you a sense in terms of the numbers. So the number confirmed Delta variant in Bedford, 608, and then all cases since 1st May to 2nd of June is 1,111. So really the purpose of surge testing, and Mary might go on, Meredith might go on to this in more detail, is obviously to enhance contact tracing, but ideally to identify people that don't have symptoms, who may have the Delta variant. And the idea is to monitor, suppress that spread of COVID-19, and for us to better understand where new variants are and how we can prevent them from spreading. As we know, Reading and Woking have seen a significant increase in the rate and number of Delta cases, which are not linked to travel, and you can see their case rates going up. In terms of the eligible postcodes, I won't go into too much detail. I'll just identified those for those watching. A lot of the information is available on the local authority websites in terms of where they're actually doing the surge testing, and I'm sure Meredith will go into more detail about what that involves. So in summary, viruses mutate all the time. The Delta variant is likely to be more transmissible than the Alpha variant. The Delta variant will likely become the dominant strain over the coming weeks. However, as I said, 2 doses of the vaccine appears to provide good protection against the Delta variant. There remains a level of uncertainty around the impact of the Delta variant and its impact on severity of disease and hospitalizations. And hopefully the next few weeks will provide a lot more information in terms of what the future might hold in terms of growth in rates and what that impact might be on hospitals. Given that a large proportion of the population are yet to be fully vaccinated, there are concerns that cases will rise across the country. However, I think we need to be clear that a lot of people have been vaccinated above the age of 50, so our case rates remaining low at this moment in time. And as I said, we really need to continue to encourage uptake of the vaccine across all age groups. It's really important, particularly with younger people who maybe feel they're immune from the virus, who maybe feel that they won't actually suffer as much. I think it's really important we do as much as we can. I'm sure Joe will cover that in a minute. And as I said, those individuals that live, work, or go to school in the affected areas within Reading and Wokingham, we strongly encourage you to get a PCR test as part of the surge testing. So that's all I was going to ask. I don't know if Meriton wanted to add any more. Happy to take any questions.
Sure. Would you like me to?
Well, I was just going to, Meriden, thank you. I was just going to ask members for a steer on this. I mean, I have a couple of questions for Matt, but I'm perfectly happy to let then we'll do a double act, shall we? You speak, Meriden, and then if we've got questions, it'll either be you or Matt that answer them, or both of you come in on a question. Thank you.
Okay. I mean, Matt's made a couple of very important points. One is that 79% of cases that are sequenced are the variant. So even though we may appear to be seeing reasonably low numbers, it's probably a well underestimate, because they're still, even though they're trying to sequence all cases, they're still only sequencing about 60% of cases. And certainly what we've seen in Woking and Reading through all the outbreaks, virtually all the outbreaks have been positive for the variant. And I think the second thing to bear in mind is it can take a couple of weeks to get the sequencing back. So there's always a week delay in the data, then there's another 2 weeks. So you're looking at 3 weeks behind really on that actual data. But if you look at where they can do the S gene, which is the scientists are now saying that is a probable marker for most of Indian variant. If you particularly look at Woking and Reading, the numbers are actually much higher. They're well over 100 if you look at the S gene. But that takes another couple of weeks to confirm. So we're always a couple of weeks behind. So the scientists are actually saying that we're moving towards this variant becoming the dominant. It is in the north. It will become the dominant in the south. And just one way of looking at it is consider that all positive cases in the future may well be this Delta variant and sort of just treated accordingly. Which means it's more transmissible, and if vaccine don't work, we will see higher hospitalization rates. So I think that's the context of it in terms of the concern about this variant. The surge areas, the reason we decided to do that in Woking and Reading was because there were so many of the variant cases that we couldn't track to travel or travellers. And the other thing was schools outbreaks was pretty much caused through parents first and household transmission, and then transmitting to the children into school, not the other way around. So it's not actually schools that was transmitting the virus. So it was quite extensive community transmission. So all of that was the reason why we were doing it. It only started today. And I think Matt outlined very nicely all the reasons why you do it, trying to stop the transmission so the vaccine can work.
Okay, question, Andy.
Thank you for that, Matt and Meriden. Just a question about hospital admissions. Appreciate it's very early in the data, but I just wondered whether there's any modelling around what we might expect and whether that was going to be an issue for us in conjunction with other respiratory illnesses. I understand from colleagues at RBH, for example, that there are real worries that will follow the Australian pattern and have greater levels of people going into hospital with other respiratory illnesses because we've got low levels of immunity with being in home all the time. Has any modelling around that been done? Is it something we need to be concerned about at this stage?
There's no systematic modelling being done. Hospitals are doing some of their own. Scientists are having a go, but there is no systematic modelling happening. It's very difficult to know what the criteria are for modelling. They're not sure where it's going to start. They don't know when a new variant might appear. So we haven't actually got some good modelling to work on at the moment.
Yeah, I was going to add, Sage have tried to do some modelling, Andy, but there's so many limitations and caveats around it. I was going to present it, but I just thought it's not worth that because I think, we just haven't got that certainty yet.
That's a good way of describing it. There are too many caveats.
Councillor Doherty.
Thanks, Meriden, and thanks, Matt. If I'm a West Berkshire resident and I'm working in one of the Reading postcodes, you mentioned PCR testing. What's the format then? Do I get PCR tested at my place of work, or do I come back to West Berkshire and get PCR tested? What do we tell residents about living in West Berkshire working in Reading where they're surge testing? What's the information and advice we should be giving out to our residents?
The first thing to advise them is to go onto the council website and go and get tested. Anyone who works in any of those postcode areas, just to go on the council website and turn up at one of the sites. There's going to be 16 sites by the end of the week, open anywhere from 7:30 to 8 at night to make it easy. What they're doing separately is they're going to contact particularly small businesses direct, just to say, is there a better way of doing this? Would it be easier if we dropped off some tests and you do it yourself? But what people would do is they still do this test themselves, and then we have to collect it. So we are talking to businesses to try and encourage them to do it.
Sorry, Meredith, they're doing the PCR test themselves?
Yes, that's right.
Oh, right, okay. I didn't realise they were doing PCR tests themselves. I thought it was lateral flow. Okay.
No, you can do the PCR tests. So it's preferable if people do go to one of the sites, but to make it easy for people, we're contacting both schools and some businesses to see if it would be more acceptable to drop off tests, if people do it themselves, and then we go and collect them.
I think just to add, Councillor Doherty, I think some people get confused between lateral flow tests and PCR tests. Obviously, PCR tests, they're the only ones that can get sequenced, so we can actually identify whether it is the Delta variant. So what we don't want the public to do is get confused and do a lateral flow test when actually they need to go to one of these sites to get the correct test kit. So I think that's an important point to make.
Yeah. It would be very helpful, actually, to put out communication to the residents to encourage people to get the PCR tests, because we're offering around 70,000 tests.
Well, clearly there's a whole question about comms, and I will try to gather some thoughts together. But let's first, Councillor Macro.
Thank you. You mentioned council website. Is that the Reading Borough Council website?
Yes, both the Reading and the Wokingham. Anyone in Reading and Wokingham can go to either, and there's no reason why there can't be a link to all the sites to go onto West Berkshire website.
Thank you.
Councillor Macro stole one of my questions, as you know, as is always the case. And indeed, Martin will need to pick up this when we get to the comms piece, because certainly we will want to have links and signposts from our website into anywhere this information is. If it's not on our website, we want to make sure people can reach it quickly and cleanly if they're looking on ours. So that was one of my points. The other one, I just want to just develop my understanding here. So Matt, you were talking about, and this is addressed to both of you obviously, but Matt was talking about something just under 9,500 instances of Delta that had been that have been looked at in terms of age profile, vaccination profile, etc. And my ready reckoner says that the number of double jabbed people who have been found in that 9,500 is roughly 3%. So when we go back to the numbers the epidemiology numbers that you were looking at, Matt, and the rise, not so much in West Berkshire, but in other areas of Berkshire, in the 65 plus, or I can't remember if it's 60 plus, or whichever it is, the age plus rate of incidence of testing positive. How does that compare to vaccination data? In other words, one would expect, would one not, correct me if I'm wrong, that those who have been vaccinated are less likely to test positive than those who haven't been vaccinated. And therefore, and given that we know, and we'll come on to Joe in a moment about the number of vaccinations, that the older the population, the more likely they are to have had both jabs by now. Question whether that is panning out, whether the instance of Delta in that vaccinated population is in line with what we think that the protection afforded by vaccination is to the population.
I can answer that if you like, Meredith. So yeah, the data we have to hand suggests that the majority of Delta cases are falling in those under the age of 50. We just need to be cautious though, because whilst we're seeing bigger numbers in Reading and Wokingham, until we get a bigger sample size in terms of, increase that number, that gives a better sense in terms of how effective those vaccinations are. And that's what they're looking at nationally. So absolutely, we are seeing it within the younger age groups in terms of the data I've seen today. I don't know if Meredith has any additional intelligence from what I've seen.
No, not really. No, but I think the other part of your question is whether 3% of double vaccinated people actually getting COVID is reasonable for the percentage that doesn't work. I think we're just learning that, but I think anything up to 5% is still reasonable. If 95% of people vaccinated don't get ill, I think that's a pretty good success of vaccination.
But it's not simply that. It's not simply not getting ill, Meriden, isn't it? It's getting less unwell. So I'm taking it that we then that links into hospitalizations, as Andy raised earlier, and the question as to whether or not those people who have been fully vaccinated, and nevertheless, and we've accepted all along that there is still a risk to catching something that you have been vaccinated against, be it flu, COVID, or whatever. But the question is, if you don't get anywhere near as ill as you might have done in any event, then that's the double benefit of vaccination. Most people won't get it, and those that do aren't anywhere near as ill. That is correct, isn't it?
That's right. Yes, absolutely.
Thank you. Members, any more questions before we move on to Joe and the vaccination programme? Right, let's move on. Joe, over to you.
Thank you. I will make sure I check that you can see my screen this time, which hopefully you can.
Yep, you're there.
Brilliant. And apologies in advance if my internet goes like last time. I'll do my best to get through it. So regular viewers and members will be quite familiar with this report now. And just to cover the kind of usual caveats regarding when the data is captured, meaning that we could be looking at something that's coming up to a week out of date already, but it's the best way to provide the more comprehensive breakdown on vaccination take-up data. And we're also missing data from a couple of practices registered in West Berkshire because they don't use the same clinical system, but likewise, this gives the best kind of breakdown we can get. So about 91% of the population is covered for West Berkshire residents. So headlines that 73% of West Berkshire's population, I would say adult population rather than eligible population there, has had at least one vaccination, which is a 6% increase versus 2 weeks ago. And 46% have now had their second vaccination, which is really good uptake following the message that those aged over 50 and with underlying health conditions should receive their second dose earlier. I think we can see in the data that effort really paying off with the rate of increase there. Here we've got the age breakdown that we display usually. So already in the over 40s, we're looking at really strong take up, particularly in comparison with our counterparts across Buckinghamshire, Oxfordshire, Reading and Wokingham. So we're already at 84%, and I'd expect that to continue creeping upwards. And we've also made a strong impact already on the over 30s, with 50% already having received their vaccination, and I'm sure several more appointments, to say the least, over the next couple of weeks. And just to highlight at this point, anybody who follows the news will have heard the Secretary of State announce that the vaccination programme will be open to the over 25s as of tomorrow. So I'd encourage any younger viewers to book their vaccination. And I've already texted my sister to prompt her to book hers. This breakdown shows by age and by ethnic group. So it may be a little bit difficult to see at this point because the spreadsheet's quite small. But we're seeing, again, replicated in the younger age groups, what we know to be true in the older age groups, that the white British population are very good at booking their vaccine very quickly, and it takes a while for the other ethnic groups to catch up. However, the last couple of weeks has seen overall rates increase among certain ethnic groups quite well, probably reflecting the fact that these ethnic groups tend to be younger. So proportionately, their rates are increasing more. And this slide showing those patients in particular at-risk groups. So showing really good take-up of the 2 doses, which is really important. And still some work to do among the younger people who are in those at-risk groups. So hopefully we'll be seeing some really good figures there, but overall quite a promising picture. And finally, looking at some of our more deprived wards, we are seeing a couple of areas falling behind the West Berkshire wide picture. So I'll be taking that to the West Berkshire Vaccine Inequalities Group to consider how we address this and what is going to be put in place. And that brings me to the end of my slides. So are there any questions?
Well, for those watching, I think I'd make the same comment as I made last time. I think that looking at that LSOA chart, that they catch up, that whilst there may be a lag in certain wards, nevertheless, if you start looking at the 80+ vaccination rate, it looks like it's there or thereabouts to the rate across the whole of West Berkshire. And the other point we discussed last time, those who had a first dose, but not for some reason had their second, and there was a question about people not being unwell when their second date came round. Are we seeing that number? Are we seeing that narrow? The number that have had a first but not had a second reduce?
Yeah, certainly in the at-risk groups, I think that's where it's most visible in the data. Is this pink colour represents below 19% that have only had their first dose compared to both. I'll have to skip back through my slides to see if that was covered for second doses. No, so I haven't got here on the slides a breakdown of first, second by age. So it's not as easy to demonstrate. But yes, I would say that, yeah, those numbers who are not coming forward for their second dose are very small.
Fine. Okay. Members, Councillor Macro.
Thank you. I think what we've seen in the kind of case numbers and hospitalisations and so on emphasises what we've heard already, really, that we really need people to have the 2 vaccination doses to get good protection. So I was wondering what we can do really to encourage people to get vaccinated, and in particular to get that second vaccination.
Yeah, I think it is important to highlight, particularly for those in the over 50s group or with underlying health conditions, that if you have for some reason you weren't able to make your second dose, it's never too late. So even though the centre at the racecourse will be closing shortly, that doesn't mean that if you've not already had your second dose, you can't. You absolutely can. It just may be you need to go onto the national booking system, so the NHS website, and book a second dose. And that can be wherever in the country, if that's more convenient for you, and more appointments and availability gets uploaded all the time. So I guess really it's that message of it's not too late. There are alternatives. And if you really struggle, email your GP practice and they'll help advise you on how best to get your second dose.
Right. I went on to a site which gave you your nearest vaccination centre on Saturday, I think it was, and it said that mine was in Basingstoke. Later on, the midday scheme popped up. So, I think it gets a bit difficult if people go on and they see some site miles and miles and miles away, and they don't realise they should try again later, and when the other appointments have become available. I'm just wondering if there's anything we can do to encourage people to do that.
I suppose we could definitely do some comms and some more messaging around, just keep trying, just keep looking, because availability is added all the time. And as you yourself in the same day, the situation changed and a far more convenient location was added. So I guess it's alongside those messages around how important it is to get your vaccine, is that don't give up on your first try, because more gets added all the time.
I think it's a difficult message to get over, that one, Richard. But yeah, we need to do it.
Indeed. Any more for any more? Well, I'll say thank you to Joe, and let's move on to Sean and a question about how the Public Protection Partnership is doing in these interesting times. Sean.
Thank you, Chair. I've just got three substantive slides, and I'll go through them fairly quickly. I'm conscious of time, but it's just really an update on matters I've spoken about before.
Councillor Macra, I'm assuming that's an old hand. Go on, Sean.
Okay, we good? All good there? Okay, so I'm just really going to cover three areas, if I may, Chair, around our work, and primarily our work over the last 2 months, because I've given updates on these things in the past, but just to give you some sort of sense of where we are. So in terms of the outbreak containment work we're doing, we're still continuing with the 7-day monitoring of cases that are reported into the authority. These are primarily cases which are in either kind of higher risk settings, such as workplaces, schools, care settings, early years, etc. The data for that comes from either the National Test and Trace System, from public health, or from the actual public health colleagues, or from the actual settings themselves. So we do get notifications coming from things like schools and other settings and workplaces. What we're really looking for there is obviously evidence around things like clusters or outbreaks or trends in particular, and trends are quite important when it comes to driving some of the compliance work that we're doing. Obviously, as part of this role, we do work and support either outbreak investigations where we get them. So some of the workplace stuff we carry out ourselves, but also we support colleagues from other settings where the expertise, such as schools and things like that, and assist with incident management teams. And you'll recall actually that Matt himself talked about some of those outbreaks we had in the early part of April time, late April as well, around schools. So the contact tracing levels are currently low, but we continue with those the contact tracing on a 7-day basis, and we have all the way through April and May and through the bank holidays that sit around that. Obviously, should rates start to rise locally, then that work will increase, as we've seen in the other areas that the Public Protection Partnership covers. From the information, we also carry out kind of intelligence-led audits of settings, and particularly those where there appears to have been any form of kind of common exposure points. And lastly, we've got the issue of quarantine facilities, where we have carried out inspections and audits as well. So just quickly moving on to compliance. So I think really since the last time we talked about this in any detail, we've been through step 2, obviously, with the reopening of retail, hospitality and close contact. And then step 3 in particular around indoor hospitality, museums and other kind of settings. Throughout that, we carried out business briefings. So at step 2, we carried out sector-specific business briefings. At step 3, we carried out a briefing based on the changes, particularly around indoor hospitality. Locally, we worked with the BID in doing that. And the compliance visits that we've actually carried out are conducted not just 9 to 5, Monday to Friday daytime, but also evenings and weekends. So they're very much a combination of kind of daytime checks, for example, on retailers, and evening and weekend checks, for example, on hospitality settings. Since the beginning of April, we've carried out 330 of those visits in West Berkshire. Probably going on for 2/3 of those are around hospitality, but we've also covered areas such as non-essential retail, close contacts such as hairdressers, barbers, nail bars and the like, but also things like gyms and other settings of that nature. And we continue to do that now through June, and we'll see where we are after the 21st of June and where we are with the roadmap. They are primarily based on 2 things, really. They're either intelligence-led, so they could have been areas where we've had complaints from, for example, members of the public, or we've had information come through from other sources, like the police, where they've raised concerns. or the revisits, or primarily their risk-based visits. So that's the reason why basically so many visits, for example, to areas like hospitality and some of the other settings like close contact, because we try and concentrate the resource we've got on the risk that we've got. Up until recently, we were supported by the work of the COVID marshals, who also, as you're aware, visited a lot of, spent a lot of time in the all over West Berkshire, but also did visit some of the settings as well and just engage. And going forward, we will have some support to support some of this work around licensing liaison. We're continuing to get a fair number of service requests. So far in just April and May alone, we've had around 85 that just purely relate to COVID, and they're split roughly sort of 2/3 around business advice, where businesses said, you know, can I do this X, Y, Z, or can you advise us? And then a number which are matters that are brought to our attention by, as I say, the public or other agencies. Generally, what we found is that there is good compliance. We report back on this kind of every week, as you're aware. But where there have been non-compliance issues, we've carried out follow-up visits, and where appropriate, there are obviously some words there. Obviously, we have basically issued a couple of formal notices. I mean, there were, you know, as I say, the compliance was good, but there were kind of nuances and things like this around things like enclosed spaces when we were in stage 2, and obviously that's still relevant in stage 2 because it guides the numbers of people that can meet together. But we've moved forward from that now. So finally, I've talked about this as well in the past, but just to give you some indication. So we have a significant number of events if you count all the multiple events, but we've got 67 currently listed as live, and they consist of either a single event or groups of events, such as the events down at Englefield, for example, where there's 3 musical events, and a number of others that have been run by Corn Exchange and the like. 12 of those groupings have already been considered by the Safety Advisory Group, which is the group that considers this, which has all of the agencies on, and crucially now has public health team on. We've done a fair bit of work actually also with the racecourse around the sort of return of kind of crowds to racing. In fact, we met with them in the last week or so, basically to have a look at their kind of latest risk assessments ahead of the meeting that's coming up actually in June in a few days' time. The range of these things is quite wide now, and they include things that we perhaps wouldn't have looked at in the past. So things like markets. So as you know, we had the artisan market return this last weekend, very busy, very popular, through to things like theatre and arts, but also grassroots sports, lots of running events, and then, as I say, music events such as the planned events over at Englefield. There's a significant amount of work really goes into these things, particularly with event organisers, but not just on the kind of COVID-19 risk management issues, but also on the whole range of wider safety matters as well that we would normally look at. So public safety, licensing related issues, and in fact actually issues about how we can mitigate nuisance as well, which is obviously something where we're still getting fairly high levels of complaint, not about events, but just about nuisance in general. We do carry out compliance checks based on risks. So each event that comes in, we risk rated ourselves to see whether it is something that we need to attend, just to make sure that it's been that the risk assessments that we've looked at are being complied with. And I think really where we are now, there's a number of event organisers are really kind of holding back to see what happens in terms of the announcement on the 14th about what will happen post the 21st of June, because clearly at the moment there are limits on numbers unless you're one of the trial events, and the decisions around the 21st of June could be a big factor in where event organisers go with some of these things. So that's my update, Chair.
Thank you, Sean. I see no one itching to ask you a question, so thank you very much for that. We shall move on, and I am conscious of time because if no one else has, Sean and I have got another meeting to go to. Well, I hope I don't know if you're going to turn up. I'm certainly trying to go to it, Sean. So let us move on. Martin, taking that on board, my caveat about time, a brief summary, having heard what we said about the need to get the messaging out about the second jab that Councillor Macro raised, and indeed just as importantly, if not more importantly, getting links into Reading and Wokingham's and possibly our own commentary on Delta and testing and PCR testing and the workplace issue.
Certainly, thank you and good evening, everyone. So if we pick up with surge testing first, that's been obviously the subject of much discussion this evening. It's been a focus for us over the past few days, tail end of last week, and certainly today as we react to an increase or an increase in the area of the Delta variant. So over the weekend, there was the reporting about the start of surge testing in the Reading and Wokingham area. While that has not prompted a commencement of surge testing in West Berkshire, we were, however, conscious that residents would wonder what the situation was with respect of Delta cases locally, and what we were doing with regards to surge testing, and if we weren't doing, why not? So we've been working with our colleagues in the public health team today to confirm our position and to put out a statement confirming what the situation is locally, which in summary, as you've heard, is that cases are increasing but not as dramatically as in other neighbouring authorities at this stage, and that the decision has been taken not to do any surge testing locally. So that statement has gone out today, this afternoon, in fact, to the local media, to our local councillors and other stakeholders. We've published it on our website and shared it on social media, all the places you would expect it to go. And to pick up the point made earlier about linking in with colleagues over the border, the statement includes right at the top links to surge testing information in Reading and Wokingham, so it's easy for residents to find out what the situation is here in West Berkshire, and also in the two other areas as well, in particular the areas in which surge testing is taking place. The statement also does acknowledge the fact that there'll be residents in West Berkshire, particularly in the east, that either go to school or go to work in the affected areas, and provides signposting for them, as well as some reassurance that we're working with our colleagues over the border to help get the information out to local residents. And that includes our education colleagues as well, who I know are looking at how best to get that information to schools. So that information is on our website, and as I said, has been shared in other channels today, and we'll be doing a lot more work on this over the coming days, I'm sure, as we continue to monitor the situation and update our residents accordingly. To pick up on the second point around vaccinations, we have over the past couple of weeks and before that even been promoting vaccinations and the importance of them in support of our colleagues in the NHS and in the CCGs, and that's certainly something we'll be continuing to push this week. And we heard earlier that the vaccinations are going down to the 25-year-olds shortly and continue to go down further. So we're going to be looking at how we can get that message out, particularly to the younger group that have been patiently waiting their turn, just to let them know that their turn is either here or coming soon, and just to encourage them to go and get their vote get their vaccination when their turn comes. And certainly what we've heard from speaking to colleagues today is that those that we've been speaking to are keen to get the vaccination for different reasons. So we will be continuing to push both of those messages this week. Aside from surge testing and vaccinations, we've continued to promote community testing and the importance of PCR confirmation test for those lateral flow tests which come back positive. Continuing to fine-tune the community testing arrangements that we have locally and share those updates with communities. Also, we've launched our Parks and Open Spaces campaign since I last spoke to you, and that's been well received by our communities, helping people to enjoy our open spaces responsibly and to be mindful of the social distancing regulations that continue. And finally, Chair, just we're waiting for the step 4 announcement next week and what's likely to happen on the 21st of June and what further communications activity we need to do as a result of that. So a busy time, particularly in respect of surge testing, but happy to take questions on anything I've covered today.
And yep, Councillor Macra.
Thank you, Mr. Chairman. You mentioned school students going from West Berkshire into Reading, but we do have quite a large number of Reading students coming out to schools in this part of the area. There's 3 or 4 double-decker bus loads come to Field Green. I was wondering if we're going to try and do anything to encourage those students who come from those particular postcodes to get tested.
It's a good question. As I said, we're working with our colleagues in the other 2 authorities, and in particular the education teams. And my understanding is that actually that information flows working both ways. But it's a good point, and I will follow that up with Matt Pearce after this, just to confirm that is the case. But it's my understanding that it is.
Thank you.
Thank you.
Thank you, members. One thing I will add is that although it's not directly a COVID comms piece, we relaunched the Let's Get Active Fund today, and there'll be comms coming out about that in the very near future. And that's obviously intending to get people out and about, which I think we're all in favour of, and it's good for us generally, let alone getting people out and about in these straitened times. So, members, the only other thing to look at is the question of future meetings. We have a meeting in the diary for the 21st of June, and obviously that may or may not be a significant date. We will know more next week, I suspect. But I'm going to suggest, just to remind everyone what I said last time, we'll take this as it comes. What we'll do is we'll leave the meeting in the diary for the 21st of June and get the invites out for that. And on the 21st of June, we'll decide if we need another meeting in a fortnight's time. And if we do have one, we'll then decide if we need another meeting, and so on and so forth, because this is an ever-moving picture, and we need to not meet just for the sake of it. But on the other hand, I do think, particularly, I mean, today's been a prime example where we're looking at Delta variant on our borders. And I do think it's important that we get the message out to the public and have this as a trigger for that process about what is going on within the district and the wider world of Berkshire and those neighbours on our borders. So that is the plan. I'm hoping that everyone agrees with that. So I shall see. Well, I'll see all of you in a meeting sometime. But we'll. So far as local outbreak is concerned, I'll see you all in a fortnight. So, members, I'm now going to close the meeting. Obviously, as usual, if you could remain until we confirm it's stopped streaming, Gordon.